right atrial pressure should be the lowest in the body, right? Right atrial and left atrial pressure are about the same. Typically, right atrial pressure is a smidge lower than left atrial pressure is. So what right atrial pressure tells us a bunch of things. One of the things it tells us is how well is blood returning to the heart, right? Remember, the cardiac output pushes blood out into the circulation. What comes back on the other end, we call venous return, okay? Now, the two, over an hour, the two have to match, right? The output and input have to be the same because you're not adding or taking away blood, okay? But in the seconds to seconds, there are small variations. You know, the heart stays in balance, it keeps up, but if you, for example, if you suddenly got up and started walking up and down the hallway, at first your right atrial pressure would increase, right? Now, that increase in right atrial pressure will result in an increase in EDV, right? That increase in EDV, increase in stroke volume, increased cardiac output, right? So it won't be very long and your right atrial pressure will come back down, even as you're still walking up and down the hallway, right? So these things subtly change all the time. So the right atrial pressure at any given time is determined by the balance of blood being pumped out and the balance of blood returning to from the vena cava into the atrium, right? So at high heart rates and high cardiac output, RAP goes down, right? The heart is essentially emptying its bucket. If you want to think of the heart as a pump, well, if the bucket's empty, the heart can't pump out anymore. That's at high cardiac output, the right atrial pressure decreases. There's no blood to pump out. When venous return is high, that tends to increase right atrial pressure. In other words, the more blood that comes back to the heart, the more ends up in the atrium, the higher the pressure in that atrium will be. All right, so what are some of the things that affect this amount of blood returning to the heart, this venous return? Obviously, blood volume, how much blood you have, is going to play a role here. The greater your plasma volume, the greater your venous return, okay? The converse, of course, is also true. If you've had a bad incident with a chainsaw and you're down a liter or two of blood, well, your venous return is going to be very low. Your right atrial pressure is going to be very low. Why? Because there's a bunch of blood on the ground and not circulating in the system, right? So until you add volume back, you're never going to get back to where you need to be. Okay, so blood volume changes. Another, there's our friend venoconstriction, all right? So veins get bigger and veins get smaller. We call that idea capacitance. Capacitance is how much or how well can a thing be stored, right? So when capacitance increases, you have more volume you can put something in. So in the venous system, that's venodilation. If you dilate your veins, the veins can hold more blood, okay? If you constrict the veins, like here, you reduce your venous capacitance, that's going to tend to increase your venous return. You're squeezing the blood out of the veins and into the right atrium so it can get pumped out by the heart and do some work. See? So that's venoconstriction. Veins get smaller to mobilize that extra blood. Another thing that will increase venous return is a decrease in total peripheral resistance. We've been talking a little bit about this term for a couple days now. Blood leaves the heart, it has to pass through arterioles before it comes back to the heart. All those arterioles together create a resistance. Well, if the sympathetic nervous system decides to take a little nap, right, because the patient's asleep, all right, so their total peripheral resistance decreases, vessels all over the body get bigger. Well, that makes it easier for blood to pass through, so more blood returns to the right atrium, right? So when total peripheral resistance goes down, in other words, when arterioles vasodilate systemically, like system-wide, there's less resistance, more blood comes back, so we get a fuller right atrium, a higher right atrial pressure. All right, there's our friend Frank Starling again, right? Frank Starling relationship says as EDV goes up, ESV goes down. Relating this to right atrial pressure and venous return, it means that when venous return increases, EDV goes up, right? Well, the cardiac output will be increased simply because of that. Let me rephrase in a way you've heard before. If the heart is fuller before it contracts, it empties more completely. That's all this says. As venous return increases, cardiac output also increases by the Frank Starling mechanism, right? That's that EDV ESV relationship. All right. Normally, right atrial pressure is low, close to 0. 0 to 10, 10 is high. Like there's not a lot of wiggle room here. But do remember when you're looking at venous pressures, it doesn't take a lot of pressure to move blood through the venous system. Veins are big and fat. You've seen them now, right? So veins are big compared to their arteries that go with them. Veins are also very smooth inside, right? So it means that veins have very low resistance. It doesn't take very much pressure to move blood through the venous system. So like once you exit the capillaries, you have lost almost all your pressure. But the blood leaving the capillaries is still significantly more pressurized than the blood in the right atrium. That's important because that's how the blood's going to get there, right? It's going to go down its pressure gradient. So right atrial pressure is directly related to venous return, and then venous return has its connection to cardiac output because of the Frank Starling relationship.